Well, skin to skin has been around for a long time. It's nothing new, but it's this developing this attachment with your baby from birth. So it's important after you've had your baby, if you and baby are well, the hospital will facilitate that skin to skin and allow you and baby to have the front surfaces of your body touching each other. It's very important for a number of reasons. For the newborn, it helps stabilise temperature and respiratory rate and all those sorts of things. But both of you will be releasing a hormone called oxytocin at that time, which is a hormone that promotes that bonding and attachment. And you learn so much about your baby by being close to them, and it will help you to learn their cues and be more, be able to be responsive to their needs. So the progression from skin to skin to baby-led attachment is really simple. I often say to mums, start by getting your babies underneath the arms like this, because that will allow you then to lift baby up on top of you. You'll be in a semi-reclined position, and the level of recline needs to be adequate to allow baby to have enough space to lie in on your abdomen like this. If you're sitting like this, obviously there's not enough angle. If you start like this, baby will then be lying on you, because the temptation is always that you bring in babies like this and they're a little bit side on. In this position, they still use the same reflexes to get to the breast as they do in this position, but it's been shown from research that in this position it dampens some of those reflexes that might be interfering with latch. For example, in this position, mothers often say the hands get in the way, or the baby's head's bobbing and the baby doesn't actually get a good latch. With the baby bobbing here, this important part of the face that should be in touch with the breast is out in thin air. So the baby doesn't get those cues as to where he is. Because remember, he's doing this by touch, not by sight. So if we start like this, we bring baby up onto the breast, this little arm goes in underneath. We're just going to hold baby there. And you've got a free hand here if you do need to assist baby with the nipple as he or she moves himself down to the breast. As far as where the body ends up, it doesn't really matter. Sometimes babies will be straddling mother's leg, and as long as the baby's comfortable, that's fine. Often they'll be more oblique, or sometimes if you've got a little baby and you feel the nose is closer to the breast, you may need to just move baby around, making sure you don't sit up and move baby around, you stay in that position. The other thing about this position, it allows baby's head to be extended when he is at the breast, so that it automatically takes the nose away from the breast so that baby can breathe while feeding. We don't want any pressure in behind the baby's head. We need baby to be in control, so that if he needs to pull off, he or she needs to pull off to recover and rest before feeding again, he can do so. But we don't need any pillows or any prompts for baby. Baby's just going to lie on you, held there by gravity. When you leave hospital, you're often led to believe it's all about mothers attaching babies to the breast, but in fact the babies are quite capable of doing it themselves. So this promotes a little bit more baby-led attachment. From this position, your job now is for you to be comfortable, and you may need to calm the baby. So if baby was really upset because they're very hungry, you might pop your finger in their mouth to calm them down, or if you were using a dummy, you may pop that in momentarily just to calm the baby down. And the other job you have is to keep this bottom part of the face and cheeks in touch with the breast. Baby's doing this by touch, not by sight. So from there, baby will then manoeuvre themselves down to the breast. Now, often this can be perceived as negative behaviour. They'll often arch their back, they might kick off your legs, but what they're doing is actually getting themselves into position, and we need to just allow them to do that and let them take the lead. Now, of course, mothers can help, And it may be that mother may need to lift a breast up if the nipple is, if she's got a large breast and the nipple's down quite low and it's difficult for baby to get. Sometimes mothers may just, pinch the breast up a little bit to give baby a little bit more something to take hold of. Mothers often say baby doesn't open his mouth when he comes to the breast. This positioning will elicit that open gape from the baby. So there's nothing you need to do to address that. When baby does latch, we're not so concerned about what it looks like, it's about how it feels for the mother. So if it's not comfortable, it's not right. You need to detach. Go back to this position and let's try again. Don't worry about what the lips look like, what everything else looks like. If it's comfortable for you, then baby's doing a good job.